What we have now is a possibility of a vaccine that is specially engineered to be able to deal with the Omicron variant. And that in turn should lead to even greater protection against it and against other variants that are related to it. This is all good news. Okay, what I wanted to stress today is how important it is that we continue being active on two different fronts here. The first is to keep the vaccinations going because they do protect people from getting severely ill and dying when they are affected by these viruses. There's some suggestion that vaccines will also give some protection against long COVID. But I also want to urge everyone to remember this is still a dangerous virus. We know how to prevent spread. So if we can continue with our face masks, with our physical distancing, and most of all with respect for the virus, that would be really helpful. We want to keep the levels of virus down at the same time as keeping the hospitals not overloaded with cases, and that's the strategy.
Inoculating 5-year-olds in Wales against COVID-19, is that something that should be rolled out further?
Well, there's going to be constant questions about how low an age group you go to when you're vaccinating children. On the one hand, it's highly desirable to protect them. On the other hand, there's a constant question as to whether or not there is the level of risk in children that there is in older people. My own view is now that we know that vaccines can give some protection against long COVID, there is a growing case for immunizing children. And so I think that from my point of view, this is the direction to go in.
I'm just reading that the World Health Organization's regional director for Europe, this was at the beginning of the month on the 3rd of February, saying that 30% of all COVID cases since the pandemic began have been reported this year alone. And the European region recorded 12 million new cases in a week. Should we really be in a position where we are loosening off what we've put in place to try to protect ourselves from COVID, given, a third of cases this year alone?
Well, first of all, it is people who are going to deal with this pandemic. The virus is the problem and people are the solution. And more now, as I talk to even quite large groups of people, I realize that they are making up their own minds as to how to get on top of things. And it is absolutely not a good idea when cases are as high as they are, when the virus is moving as rapidly as it is, for the restrictions that we've all applied so carefully to be dropped. Please continue wearing face masks, continue physical distancing. It's the right thing to do. And whatever else you hear from other sources, I can assure you the World Health Organization asks everyone to maintain the caution because the virus is really moving around a lot at the moment, and you do not want to let go of the restrictions and to give the virus a free ticket right now. It's not the right thing to do. So yes, Kate, you are right. Maintain personal precautions for the time being. There's too much virus around to let go.
Two of the restrictions that are most impactful on people's everyday lives are lockdowns and travel bans. Are they effective?
Well, you know that in the World Health Organization, we say very clearly, lockdowns are last resort. They really are. They're very crude. Basically, you're stopping everybody from moving and you're requiring them to stay at home. Instead, we say, protect against this virus with good quality surveillance and local responses organised by district or similar public health officials. And we will continue with that advice, and we will very much say, do lockdowns only when you absolutely have to. You've got nothing else to do. In the same way, we're cautious about mandates requiring people to get vaccinated or else they lose their jobs, because we think they create divisions in society. And we would much rather say to everybody, you're part of the solution. We're not going to give you these very tough mandates, but we are going to ask you to work together, to work with authorities, because we can only deal with this virus by working together.